We've all been there. You reach for an ibuprofen or an aspirin to knock out a headache or soothe a swollen joint. These drugs are in pretty much every medicine cabinet, right? But how they actually work their magic? Well, that's a really fascinating story of chemical signals and, believe it or not, targeted takedowns. So let's dive in and unlock the science behind your go-to pain reliever. Just think about it for a second. You sprain your ankle and boom, suddenly it's red, it's hot, it's swollen, and of course it hurts a lot. But those aren't just random symptoms. They're actually part of a highly coordinated response. The real genius of non-steroidal anti-inflammatory drugs, or NSAIDs as we call them, is that they get what's happening and they know the exact spot to jump in and stop the chaos. So when your body gets injured, it basically sounds the alarm. And these 5 signs, redness, swelling, heat, pain, and loss of function, they're what we call the cardinal signs of inflammation. This is actually your body's defense mechanism, rushing all its resources to the site of the injury to deal with any threats and kickstart the repair process. But let's be honest, that process can be pretty miserable. So who's the mastermind behind this whole inflammatory response? Well, meet the prostaglandins. These little guys are the key chemical messengers that get released right at the injury site. They're the ones responsible for widening your blood vessels, which gives you that redness and heat, and making them kind of leaky, which is what causes all the swelling. And crucially, they also fire up your nerve cells, making everything feel way more painful than it should. Okay, so if prostaglandins are the little soldiers causing all this inflammatory chaos, the smartest strategy isn't to try and fight them one by one. Nope, you gotta go after their command center, the factory that's pumping them out in the first place. And that is exactly what NSAIDs are designed to do. And that factory, it's got a name, cyclooxygenase, or just COX for short. This enzyme is the absolute critical link in the whole chain. It takes a fatty acid, arachidonic acid, and it transforms it into those prostaglandins we were just talking about. So think about it. No COX enzyme, no prostaglandins. No prostaglandins, no inflammation and pain. It's a beautifully simple, elegant target. But of course, the story gets a little more interesting here. Turns out there isn't just one COX enzyme. There are 2, and they each have a totally different job. Just think of COX-1 as the protector. It's on duty 24/7, doing important jobs like protecting your stomach lining. Then you've got COX-2, the instigator. This one only shows up to the party when there's an injury, and its one and only mission is to trigger pain and inflammation. So this creates a really crucial trade-off. When you block COX-2, you get exactly what you want. Less pain, less inflammation. Perfect, right? But the tricky part is COX-1. Blocking it gives you both a good effect and a not-so-good one. On the plus side, it makes your blood platelets less sticky, which helps thin the blood, a huge deal for preventing heart attacks. But on the downside, you also shut down its protective job in the stomach, which can lead to things like ulcers and bleeding. And this right here is the central challenge of using NSAIDs. And this brings us right to our arsenal, the NSAIDs themselves. They all work by blocking these COX enzymes. But, and this is a big but, they don't all go about it in the same way. The differences between them are the key to understanding why one might work better for you and what the risks might be. So let's actually look at the drugs. NSAIDs are broken down into 6 major groups based on their chemical makeup. First, you've got salicylates. The classic one there is aspirin. Then there are some really potent prescription groups like parachlorobenzoic acid derivatives and phantomates. Next up is a huge one you'll recognize, the propionic acid derivatives, home to painkillers like ibuprofen. Then we have the oxycams, which are often used for more chronic pain. And finally, the newest kids on the block, the selective COX-2 inhibitors. They're all aiming for the COX enzymes, but how they do it is what sets them apart. Now, the easiest way to make sense of these 6 groups is to know that they're split into 2 big categories, or generations. And it all comes down to how they approach our 2 COX enzymes, whether they go after just the instigator or if they take out both the instigator and the protector. And here's the key difference. You can see it right here. First-generation NSAIDs are non-selective. You can think of them like a big net. They block both the helpful COX-1 and the inflammatory COX-2. This is great for pain relief, but it's also why you might get stomach side effects. Second-generation NSAIDs, on the other hand, are selective. They're like a sniper, designed to take out only the COX-2 instigator enzyme, leaving that protective COX-1 enzyme to do its job. Okay, so let's take a closer look at that first generation. This is where to find the first 5 groups of NSAIDs we just listed. Because they take that really broad approach, they are super effective at knocking down inflammation. But it's also why that warning on the bottle to take with food is so important. This first generation has some of the most famous painkillers out there. You've got the original, aspirin, a salicylate, known for both pain relief and its heart protective effects. You have the propionic acid drugs like ibuprofen and naproxen, which are super popular because they strike a great balance, strong relief with fewer side effects than some of the older guys. Then you've got more specialized groups like indomethacin, a parachlorobenzoic acid drug that's incredibly potent and used for severe stuff like gout. And you have the oxycams, their secret weapon, a long half-life, meaning they stick around in your body longer. That makes them perfect for a once-a-day dose for chronic things like arthritis. And now for the second generation. These drugs were a huge breakthrough. By creating a molecule that specifically targets only that COX-2 instigator enzyme, they could offer powerful anti-inflammatory relief without the same risk of messing with your stomach. A true targeted strike. The main player here is a drug called celecoxib. It's often the go-to choice for patients who have severe arthritic conditions and need to be on high, consistent doses of an anti-inflammatory. For those folks, the risk of stomach ulcers from a first-generation Nsaid is just too high, making a selective COX-2 inhibitor pretty much the ideal solution. Okay, so now that we get the how, let's switch gears and talk about the what to do, because understanding the mechanism really helps us use these medications way more safely and effectively. It's all about getting the benefits while keeping those potential risks as low as possible. And these tips come straight from that COX-1 and COX-2 science we just talked about. Taking NSAIDs with food, that creates a literal buffer for your stomach lining. Avoiding alcohol, super important, because alcohol also irritates the stomach, and putting them together is just asking for trouble. And because they all work on the same pathway, you should never ever combine aspirin with another NSAID, and always let your doctors know you're taking them. It is also so important to know the warning signs, especially for a classic drug like aspirin. Tinnitus, which is a persistent ringing in your ears, is a huge clue that your dose might be too high. Dizziness or any sudden trouble breathing are also major red flags that mean you need to get help right away. And this is why understanding the difference between COX-1 and CO2 really matters. It's not just science trivia. It explains why a certain NSAID might upset your stomach, or why your doctor chose one over another for you. And it really empowers you to have much smarter, more informed conversations with your doctor or pharmacist about what's actually right for you. So, the next time you're talking about managing pain, what are you going to ask? Maybe you'll ask if a COX-2 selective option is a better fit for you. Or maybe you'll ask about the best way to protect your stomach. See? Knowledge is power, especially when it comes to your own health.